and welcome to Tharaka Foundation's YouTube channel, Supporting the Whole Child. We just wanted to give you a quick disclaimer saying that everything that is found on our YouTube channel is created for informational purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition, and never disregard professional medical advice or delay in seeking it because of something that you have heard or seen on this YouTube channel. Thank you so much, and without further ado, let's begin today's video.
Hello everyone, welcome back to the Tarika Foundation YouTube channel, Supporting the Whole Child. I am your host Poonam, and I do have Dr. Leena with me today. If you remember, we were talking about depression, what could be the various causes and what can be done. We did talk about CBT. So today I would like to focus on a very important aspect of sleep. Because all of us know sleep is very important for our well-being. But if person is in depression or child is depressed, sleep might be disturbed. So let's learn from Dr. Leena what can be done to make that child or person feel better with respect to sleep. Dr. Leena?
Thank you, Poonam. I think you're bringing up a very important point and question about sleep, which is such an integral component of our well-being. It's a big building block of our not just physical well-being, but emotional well-being. We understand sleep is important for, of course, our body to heal and regenerate, but also for our immune system, for us to stay healthier. We also understand sleep has a very big role in emotional well-being, keeping those neurochemical balance in check that we see that gets often disturbed in conditions like depression. So most of the times people with depression have one of the symptoms of sleep disturbance. A lot of the times it can be difficulty falling asleep or staying asleep or both. One of the more classic signs is early morning awakening. So people may experience that they can fall asleep and stay asleep, but they're waking up too early or way too earlier than their wake up time. And that certainly, adds to feeling tired throughout the day because they haven't gotten enough sleep and they've been up since earlier in the day. In a particular type of depression, we had talked about, more classic depression and then atypical depression. So atypical depression is where people end up needing to sleep a lot. They're more tired and sleeping all day. And that also then gives them, challenges to fall asleep and stay asleep well at night. So the first step in education about sleep, we, usually tell the patients about or parents about is to expect that the sleep will fully get corrected once the treatment of depression starts to work, so therapy and or medication. But in the interim, because those things do take a few weeks for them to work, we focus on this concept of sleep hygiene. Now, have you heard about sleep hygiene, this term, Poonam?
Not really. I do know hygiene word is very good. Personal hygiene is good, but I'm sure and we need to take care of some sleeping habits maybe as part of that hygiene.
That's right. So just like we have certain daily habits that help us keep our personal hygiene and personal health in check, the same principle applies to sleep. So there are certain sleep habits that have been researched and studied, and those have been all clubbed under this topic of sleep hygiene, as we call it. So what it is you actually talk about a few different things you have to do to get good quality and quantity of sleep. So the first and foremost part of that is to going to bed at the same time and waking up at the same time. So it has to be a same routine that if you can follow as much as you can, because we know our circadian rhythm, the biological clock in our brain that kind of takes care of sleep wake cycle is very sensitive. So if we get into a particular rhythm, it stays in that rhythm. If we have an erratic rhythm or like an up and down course of falling asleep one day at 9 o'clock, the next day at 11, the third night at 1 a.m., then it is confused and it's going to not stay in a good rhythm, which impacts the quality and quantity of sleep. So going to bed at the same time or around the same time, it doesn't need to be exact, but if it's like between 10:30 to 11 is my time I go to bed every day, then I should target going to bed around that time. And then waking up, if it is between 7 to 7:30, then I should wake up at around the same time. Between these two things, the going to bed is certainly that, we hear that can fluctuate because of like, oh, I was out, studying late, or sometimes that's what I hear from the kids, or I was out at a party or something. So what we say is that it's okay to have a little bit of fluctuation there. You may have reasons. Sometimes you've had a late night and you didn't get to bed at the same time. No matter what time you went to bed last night, you should wake up at the same time the next day. Even if my regular sleep time is around 10 and I slept at 11 or 12, I will be tired if I still have to wake up at 7, which is my regular wake up time. We rather have you do that and have you put up with that than having to sleep in, because we know if you slept in, because we start to justify usually like, oh, I slept only at midnight or at 1 and haven't gotten my full quality and quantity of sleep. So you try to go to compensate for that, and instead of 7, then I wake up at 9 because I need that 8 hours, 9 hours of sleep. And what that does is that messes up the circadian rhythm again, and your cycle is then erratic. So for really having great rest and benefit from the sleep, we need to really have that consistent schedule. The first and foremost principle of sleep hygiene.
Dr. Lina, I would like to interject, and it's very interesting what you said. Even I have observed people or even kids, they take longer sleep over the weekend. They think they did not sleep enough during the week, and it's okay to wake up late on over the weekend and sleep more. But listening to you, it seems like no matter what, keep your sleeping pattern same. That rhythm needs to be there. That's a very awesome learning. Another question coming to my mind, like kids, I think they do need 8 hours of sleep, or do they need more?
So that's a very good question, Poonam. So usually the sleep, as we have researched, we understand as an infant, you need a lot more sleep. So of course, if you go back and remember when your child was 1, 2 year or 2 years old, they were sleeping most of the day. So that's until like age 4, 5, they need like 10, 12 plus hours of sleep. After that, the requirement goes down comparatively. So we still say 8 to 10. For teens, again, we see that they need higher amounts of sleep. So minimum of 8, if not 10, and an average of 9 is what is recommended for teens. And it is really sad to see with how much they are sleep deprived because of all the homework they have to stay up and do, or kind of the digital devices that distract them, which pushes their time to go to bed. There's been a lot of trouble with this with the teens that I work with, that they are barely getting 5 or 6 hours of sleep. And then naturally they are sleep deprived, and then they start to compensate that for that by sleeping in on weekends, which is, ideally not recommended, but we also understand they need to have that reserve built for the next week or catch up from the deficit they've had the previous week. So what we advise is that it's okay to give a little leeway. And at a workshop I had attended by an expert about sleep and sleep hygiene, he was saying that the research said ideally you shouldn't fluctuate even on the weekends, but push comes to shove, you can give 1 to 2 hours of leeway, but no more than that. So it shouldn't be that you're normally like on weekends, your child is now waking up at noon instead of like maybe 9 or 10 if they were waking up at 7 or 8 in the morning previously. So it's important to like play the catch up during the week itself. And what we suggest is that often, they have to wake up in the morning because schools in the morning, like school starts, their classes start in the morning. So they may have had a late night, and they are feeling like, they didn't have the ability to wake up, but they had to wake up because they have to get to school. And so that almost forces them to keep this other time during the week of waking up somewhat more consistent. But what then happens is that they are tired by the time they finish school, and when they come back, they are tempted to take a nap because now, you're also justifying that I slept only for 5 or 6 hours and I'm so tired. So they end up taking a nap. And what sleep hygiene tells us is that taking a nap is another bad thing you can do to your sleep hygiene. Because if you've taken a nap, how that impacts you is that you're not able to feel as tired then at night because you've rested, you feel more energetic, and you have this second wind of like feeling really energetic at night because you have just, a few hours earlier, you have slept for an hour or two, and that delays your ability to fall asleep, which in turn, kind of messes up your cycle. So this vicious cycle kind of continues. You're going to bed late, you have to still wake up at the earlier time, and then to compensate for that, you take a nap, and then that actually pushes your sleeping time further. So you're in this cycle, which is really hard to break. If you get into that cycle, you have to work towards changing that bit by bit. So sleep hygiene tells us that no naps in the afternoon, ideally. But if you absolutely feel like I have to get some rest, then time it. Take a nap and put an alarm for 30 to at the most 45 minutes and wake up at that time when the alarm goes off. The reason is that if we go beyond that 45-minute mark, if we know there are two parts to our sleep, there is a non-REM sleep, which is non-rapid eye movement type of sleep. And then there is this REM sleep, which is rapid eye movement sleep. So REM sleep is our restful sleep. That's the sleep we are, dreaming in. That's the sleep that gives us the most restoration. And so our sleep is set such that, every 90 minutes we are moving into a new cycle. So within a 90-minute time frame, you're moving from non-REM to REM, and then you're going back into non-REM and REM cycle. So every night we go through these different cycles. And once you get into that dream phase or REM, that is a deeper stage of sleep, it's much harder to wake up. And you more than likely would want to finish that another 45 minutes REM sleep cycle before you can wake yourself up. So in order for us to really not get into messing up those rhythms within the sleep, which we understand, it's important to not take longer naps, ideally no naps. But if you really have to take that power nap or cat nap that people talk about, like few minutes, set an alarm, when alarm goes off, wake up and get going about your day. So that's another very important education we provide, which often helps people, because the idea is to stay awake the whole day, ideally with no naps. And what that will do is it's going to make you tired throughout the day. It's going to build what we call as sleep pressure, which is what we want. Just like we talk about other types of pressures, the sleep pressure is a good thing for us, because the more we have worked our body, the more fatigued and tired we are mentally and physically. That helps build that sleep pressure, and that allows you to then sleep earlier the next night. So, for example, I am deprived of 2 hours of sleep today because I slept very late and I still woke up early for my school. And I came home and I was very tempted to take a nap, but my doctor advised me just stretch it, just, go for a walk, distract yourself, get through that, remaining part of the day. And then instead of like sleeping at midnight, which is my regular time, what I will do today is go to bed by 10. So I'm going to catch up by going to bed earlier than, keeping that late night rhythm that I have gotten into. So by doing this, so I want to do the catch up during the week as much as possible instead of, taking naps and somehow patching through my week and then starting to like compensate for that over the weekends.
Yeah, that makes a lot of sense, Dr. Lina. But you talked about that sleep pressure. It's important we tire ourselves and sleep well. But like, do you have any recommendation? Like, what I noticed, if I'm very active during the late night, I don't fall asleep. So, exercise point of view, is there a time we should finish exercise before we get ready to bed?
Absolutely. So there are actually few other key principles to sleep hygiene. So I reviewed the two main ones about going to bed, waking up at the same time, no naps in the afternoon, and there is a few other smaller, simple ones that we I think can bring in also in our day-to-day sleep routine. So no caffeinated drinks beyond 3 p.m. in the afternoon is one of them. So no tea, coffee, sodas that have caffeine because we know that's a stimulant and that's going to affect your ability to fall asleep. For parents who are listening or viewing our episode, it's important to know also that physiologically, teenagers have what we call a delayed phase of falling asleep, meaning you and I as an adult may feel tired around 9:30, 10, but teens, their ability to feel that tiredness or even feel like they are ready to fall asleep is an hour or two later than us. So they are naturally, you know, their cycle is naturally shifted. So a lot of the times, parents will say, I'm telling them to sleep early, but they don't, or they somehow listen and they go to the bed, but I can hear them move around, or they're waking up and I can hear the movement or time them talking or moving around. So the idea is to understand that they have a delayed phase, and that not to like say that that's why you let them sleep whenever they want, but you need to have that understanding and then doing some sleep promoting activities to help them get to bed earlier. So exercise, the question you had, Poonam, closer to bedtime is also known to be stimulating or activating. So we say no exercise about 2 to 3 hours before your bedtime because those endorphins and those excitatory hormones that are released because of exercising closer to bedtime can push that ability to fall asleep, or that delayed phase is further delayed for them. So that's important to also keep in mind. The other things that we talk about are sleep promoting activities. So what we know is that there are a few things that can be done that can allow us to sleep really, or like create that environment to sleep. So a dark room, so very little light. If your child is comfortable without a night light, that's even encouraged. The reason for that is that when it gets dark, our brain secretes this sleeping hormone called melatonin, which allows us to fall and stay asleep. Then the temperature of the room, the coolness of the room also helps. The core body temperature, when it is lower, that actually has, again, scientifically drives the ability or gives the signal to our brain to shut down and start winding down and sleep. Other things like a warm shower before going to bed, that can be also super, relaxing. Listening to calm, soothing music, reading, or if you're doing audiobooks, some kids like to do that. Even in that, choose kind of more calming type of stories than like more activating, excitatory type of stories. So even what you're reading can make a difference. And then we also say you can also do breathing exercises, relaxation exercises. So in our last episode of cognitive behavioral therapy, we were talking about some behavioral strategies, the progressive muscle relaxation, that contraction and relaxation of your muscles, and breathing with that can be very helpful. Just breathing calmly can be super helpful. There are apps like Calm or Headspace that have various kind of different types of relaxation exercises or stories. What we understand is when you do anything kind of monotonous or mundane, that helps us to fall asleep. So reading, listening to any kind of music after a while, those things really help us fall asleep. So all these sleep promoting activities can be super helpful to get into a good sleep rhythm and hygiene.
That's wonderful to know, Dr. Lena. Do you have any recommendations for blue light? Like, kids generally have their phones, iPads, or their laptops until they go to bed, and sometimes they do have it on their bed. So, do you have any recommendation for that?
Yes, absolutely. So that is something I wanted to definitely interject. And so I'm glad you brought that point up, Poonam. So blue light is certainly known to be one of the culprits for why we are seeing a lot of sleep disturbance in our digital age kids, particularly. We understand that blue light inhibits the release of melatonin, which is, like I said, a sleep promoting hormone. So we absolutely have now learned through research that disconnecting from your devices, whether it's a phone, iPad, whatever that is for you, your laptop, 2 hours before your bedtime is what really helps to kind of cut that impact of blue light and help the melatonin to be released. So, I know this is a battle a lot of parents have. What we say is that make it as a family policy that everybody is going to, hang up their devices 2 hours before bedtime. So 9 or 10 o'clock, pick up the time for your family. Everybody's devices go on to the charging station. And I have seen less resistance from teens when their parents are also doing this and other siblings are also doing this. So if we all collectively, bring this habit into place, that can make a big difference. Especially, I think nowadays, and especially with the pandemic now, everything is online. We've been exposed enough to blue light and not step out to the daylight. By the way, those are other things we recommend, that stepping out and getting some daylight can really also help with the sleep circadian rhythm. So, staying away from the artificial light and being in the natural light is also one of the treatments we use to treat people's, sleep disturbance. There is also sometimes, in colder regions where there is no sunlight, we use light therapy. I think I had talked about that briefly in treatment of seasonal affective disorder when we were covering about treatments of depression. So that's often used to correct sleep cycles. Just like I was mentioning cognitive behavioral therapy for anxiety and depression, now we have lots and lots of research and studies showing the benefits of practicing cognitive behavioral therapy for insomnia. So of course, it's different than what we do for anxiety and depression. It's a little bit differently structured, but it has sleep hygiene as one of its main components, besides, of course, helping kids to like slowly advance their delayed phase. Because sometimes, we see kids who are like sleeping at 3 a.m. and then they are going to school at 8 and falling asleep in the class. And they may not or may have anxiety or depression, but this erratic sleep schedule itself can impair their concentration, their ability to do well in school, because again, sleep helps with everything, right? With cognition, with memory, with learning. And so CBTI, cognitive behavioral therapy for insomnia, is another type of treatment that can be done. And there's, of course, it's a bit more in detailed in terms of filling out logs and slowly correcting your sleep-wake patterns. But it does involve, all the sleep hygiene principles we talked about.
That's a wonderful to learn all the hygiene you mentioned, right? Don't mess up with your sleep cycle. Try to avoid naps. Go in the outside. Daylight is good for your health, and avoid exercise late during the night, and even caffeine intake. And then very important, the blue light, right? Like we're talking about the screen time, limit that before going to bed at least 2 hours. So I think these are simple things we can definitely take care and live a happy and healthy life. So thank you so much, Dr. Lena, for educating us. Hopefully our viewers are taking advantage of these habits and they are going to take good care of themselves. Thank you so much.
Thank you.